Plan B, which is currently labeled as an emergency contraceptive, was approved in 1999 by the Food and Drug Administration and is widely available in the United States. It is composed of a hormone called levonorgestrel given in 2 separate doses within 72 hours of sexual relations. Its purpose is to prevent pregnancy, but while it is claimed to be safe and effective, the newest medical information to date shows that it has concerning ethical consequences and that its claims of efficacy are highly overrated. However, as we will soon see, shocking new evidence shows that some women who take Plan B may actually be increasing the risk of getting pregnant, and others risk the loss of their newly conceived child. In addition, women might be risking an increased risk of breast cancer from Plan B. Unfortunately, few women or even physicians or nurses have heard of this research before. Today, let's break through the myths and take a fresh and honest look at the most current research. Hello, I'm Magdalene Kelly, and I'm here today to interview world expert Dr. Kahlenborn, who will address some extremely controversial aspects of Plan B. Dr. Kahlenborn, you will be laying out the case that today's women are not hearing the medical facts behind Plan B, especially its lack of efficacy and controversial method of action. You even make the theoretical case that it could be linked to breast cancer. Wow. But before we begin, could you tell us about your background?
Oh, sure, Magdalene. I'm a physician of internal medicine for the last 20 to 25 years, and I got interested in hormones and breast cancer and their method of action, and have been studying those, which has resulted in a publication in the Mayo Clinic Proceedings in 2006. I also did testify in front of the Food and Drug Administration, and recently published an article on Plan B in the Linacre Quarterly in 2015.
So to start off with some basics, what is Plan B?
So Plan B is basically a hormone called levonorgestrel. It's given in 12-hour intervals to women who wish to avoid getting pregnant. It was legalized by the Food and Drug Administration in 1999. But in 2013, it was made over the counter, so any women at any age could use it.
So a 12-year-old girl could take it?
That's right.
And would you say that Plan B is effective?
Most of the popular sources, like WebMD and Wikipedia, say it's about 89% effective. But in reality, it's about 50% effective, according to the studies, most recent studies.
And there's a major ethical question about how Plan B works. Some people say it's a contraceptive, some people say it works by causing an early abortion. I have heard that Plan B stops sperm flow and prevents women from ovulating. So how can it be causing an early abortion?
Well, let's take both phases. The first phase, the question about sperm flow, we published that in our Linacre Quarterly article in 2015. And there's a gentleman called Nascimento, is how I think you pronounce it. And in 2007, he did a study which studied Plan B and found it really has no effect on sperm flow or quality. So the question on sperm flow is really kind of been answered. As far as ovulation, you can see in Figure 1, this is a sketch of an ovulation. And you could see that the egg is being released. So we can see by ultrasound that Plan B really does not stop ovulation.
Let's examine the question of ovulation. You stated that you can see when a woman is ovulating with today's high-tech ultrasound machines. How often does a woman experience ovulation when taking Plan B?
So there are some researchers, Noah and Gabriella, and in 2011, they come from Chile. They had a large study of about 450 women. And they found that women who took Plan B about 1 to 5 days prior to ovulation, about 80% of them ovulated. So as we look in I think it's Figure 2, you can see when Plan B is given in the pre-ovulatory phase, it only stops ovulation about 20% of the time. So 80% of the time, it's still happening.
So, if Plan B does not really prevent sperm flow and minimally prevents ovulation, why isn't fertilization occurring?
It probably is.
Is there any way to prove this?
Yeah, there's a early pregnancy test measured by something called early pregnancy factor, and it was done in Chinese studies. And you can tell if you're pregnant within 48 hours with that test. It's more like a research tool, but that would be the way to tell. Where a common pregnancy test is only positive about day 14. So the early pregnancy factor test, which is also cited in our article in the Linacre Quarterly, it would be the way to measure things.
If fertilization is occurring, why are women not getting clinically or visibly pregnant?
These women are getting pregnant, but they're probably losing the baby, having an early abortion, so they don't know they're getting pregnant, but they're likely are just having an early abortion.
And is there any way to prove this?
Yeah, again, early pregnancy factor would be the way to prove it. In 1982, there's a gentleman named Dr. Smart who found when he studied the intrauterine device that women who have the intrauterine device implanted continually get pregnant, as noted by the early pregnancy factor, and yet they don't get clinically pregnant. So that was kind of the definitive study which showed that the IUD really works not by preventing pregnancy, but by stopping pregnancy. And you could use the same technology for Plan B.
And how exactly does Plan B cause an early abortion?
Plan B probably works in two different ways. One would be, it's called an endometrial effect, and one is called an early embryonic death effect.
Can you elaborate on these, especially the early embryonic death effect?
Yeah. Let me just take the first one, the endometrial effect. In theory, Plan B can change the lining of the uterus, called the endometrium, and then the fertilized egg or early embryo can't really implant and would be sloughed off, and it would be like an early abortion. The evidence is kind of mixed. For the other one called the early embryonic death effect, basically here, if you give Plan B, it lowers luteinizing hormone levels. And what's found is that in the literature, whenever fertilization occurs in the setting of low luteinizing hormone levels, the embryo only lives to about the third or the fourth day in the morula stage. And we can see that, I think it's in figure 3. I'm not sure the number of the figure there, but that if you could see on the diagram, you'll see that the fallopian tube, and you'll see that the small embryo will die at about day 4, and that would be the early embryonic death effect.
And does anyone have an explanation as to why this happens?
No one has any idea.
This is obviously a very controversial area. If the evidence is so clear that fertilization is occurring, why don't people just admit that this works by taking a human life?
I think I call it PMP, politics, money, and pride. There's a lot of factors, and now the Food and Drug Administration has legalized and made over-the-counter Plan B. So those factors are really stopping people from getting the real information, which hopefully this interview brings out a little bit.
So what about Catholic groups? They obviously forbid Plan B in Catholic hospitals, right?
Not really. A lot of the bishops have said it's okay to use Plan B under what's called the PRA protocol. So they basically say, if you haven't ovulated, we think Plan B will stop you from ovulating, so it's okay to use it.
But I thought you just said that this is the time that Plan B is most likely to cause an early abortion, that is, prior to ovulation.
That's correct.
So why do so many bishops permit its use if the information is so clear?
That's a very good question, Magdalene. The bishops basically take their cues from a group called the National Catholic Bioethics Center. And the National Catholic Bioethics Center still claim that Plan B stops ovulation.
And how can they claim that? You've noted that the top researchers in the world, such as Noah and Cressida, have given proof of ovulation in their studies which rely on high-tech ultrasound, as we see in Figure 1.
I don't know how they can continue to take that position. I personally presented the evidence to them. We've seen the drawings with the ultrasounds, even the people who are highly in favor of Plan B. Let me read a quote here. There's a gentleman from Princeton named Dr. James Trussell, a leading advocate for Plan B, and I communicated with him in 2002. He wrote, quote, "It is clear that ovulation is not always inhibited." So I don't understand how they're still claiming this position when the medical evidence by ultrasound, when the pro-plan people are admitting it. They're the only ones left who are claiming this as far as I know.
Are there any remaining arguments as to how Plan B could not be causing an abortion?
Yes, Magdalene, there are two arguments that are still proposed. One is called the redefinition of life tactic, basically, and the other is a dysfunctional ovulation hypothesis.
Can you explain these, please? Let's start with the latter, the redefinition of life tactic.
Sure. In 1965, the American College of Obstetricians and Gynecologists incredibly decided to redefine life. And they basically said, you know what? We're just going to print out in our bulletin that life doesn't start at fertilization anymore. And they just redefined it. And they said, now life starts at implantation. And so with one little tip of the pen, they tried to redefine life.
And in your opinion, why would they do that?
So what happens is, if you say life starts at implantation instead of at fertilization, all the chemical devices like the intrauterine device, mechanical device, or the birth control pill or Plan B, they really work by causing an early abortion before implantation. So when women come to you and they ask, does the birth control pill or Plan B cause abortion? These doctors basically say no, because life doesn't start until implantation. So it's their way of basically getting around this, and incredibly, they just decided to redefine life on their own.
And do doctors and researchers really believe this?
I don't think anybody with common sense believes it. None of the biologists do. Most doctors don't, but some of the academic doctors do. And I'll read a quick quotation again. I corresponded with Dr. Trussell again in 2002, and I asked him, do you honestly believe women should hear that emergency contraception has the potential to cause early abortions before implantation? If so, do you think in practice this is happening? And this is his answer: no, these are not abortions. Pregnancy begins with implantation. As I said before, I think women should be told how emergency contraception might work, including that it might work by inhibiting implantation of a fertilized egg. So these people admit that life is being taken, but because they basically try to redefine life, they say it's not an abortion.
Wow, interesting. Let's move on to the dysfunctional ovulation hypothesis. Can you explain this?
Yeah, the dysfunctional ovulation hypothesis is basically the claim that fertilization can't really occur in the setting of low luteinizing hormone levels.
And is there information now to disprove this?
Yes, actually it's been pretty well disproven by two recent studies. One is done in monkeys by a gentleman named Borman in 2004, where he basically gave monkeys a type of Plan B, which lowered luteinizing hormone levels, and fertilization still occurred, except all of the monkeys died on day 3 or 4, like the early embryonic death effect. The second study was done in humans by a gentleman named Anderes, and he noted in the in vitro fertilization literature that the tiny embryonic humans that were conceived in the setting of low luteinizing hormone levels, they all died at the morula stage, as noted in Figure 3. So this has been pretty much disproven, even though some still claim that it could be a factor.
What about women who take Plan B on the day of or after ovulation? For example, a lot of women who have experienced sexual assault or possibly taken Plan B really have no idea whether they have ovulated, right? And I understand emergency rooms don't check for this. Is that correct?
That's correct. When a woman's been sexually assaulted, the average emergency room will only do a basic pregnancy test, which will only tell you if you're pregnant after 14 days. So these women, there's no test to see if you really ovulated or not.
Well, I read in your Linaker paper that these women actually may have a higher risk of getting pregnant if they take Plan B. You quoted researchers Davidoff and Trussell in 2006 who wrote, "It even raises the counterintuitive but undocumented possibility that Plan B used after ovulation might actually prevent the loss of at least some of the 40% of fertilized ova that ordinarily fail spontaneously to implant or to survive after implantation." I thought Plan B was supposed to decrease your risk of getting pregnant, so what's going on?
So basically, this is one of the biggest controversies that now you're giving Plan B perhaps on the day of ovulation or after, and you may actually be increasing a woman's risk of getting pregnant. Even researchers who support Plan B have noted this. So what happens in this technical area is when you do these studies, you compare the pregnancy rate in women who have taken Plan B to the predicted pregnancy rate. Now, the predicted pregnancy rate is in women who experience normal conditions. So those women are exposed to normal sperm counts. But the women who take Plan B, it's often in the setting of sexual assault or condom use or something else, so they have dramatically lower sperm counts. So if you adjust for this factor, you find that women who take Plan B on the day of ovulation or after, not only does it not prevent pregnancy, it may actually increase your risk of getting pregnant, which is amazing.
Well, that is actually very frightening to hear. Let me summarize to make sure I'm understanding you correctly. Our Food and Drug Administration legalized Plan B, which contains the hormone levonorgestrel and can be purchased by any woman at any age in the United States since 2013. Now you've told us that the most current research is showing that if a woman takes Plan B prior to ovulation, there's a strong possibility of working by taking a human life at its earliest stage, and if she takes it on the day of or after ovulation, it is possible that it may increase her risk of pregnancy. Is this right?
As unbelievable as it is, that is all correct, yes.
Wow. Is there anything else at all?
There's one more point that actually Plan B, if taken often, could increase your risk of breast cancer, but it's never been studied.
And could you explain this?
Yes. When we did our study in the Mayo Clinic in 2006, in premenopausal women who took the birth control pill, 21 out of 23 studies showed that the pill increases your risk of getting breast cancer, premenopausal breast cancer. So if women take the pill before they've had children, which is most women today, there was a 44% increased risk. And it went up to 51% if they took it for 4 years or more, which again is most women. So the problem is that the hormone levonorgestrel, which is found in Plan B, is also the same hormone that's found in many birth control pills. So if a woman takes Plan B once or twice, it may not have much effect. But if she takes it 15, 20, or 25 times over the period of 15 or 20 years, that's going to have enough of the progestin hormone as about 6 months or more of birth control pills, 6 months of usage of birth control pills. So it may increase her risk of breast cancer under those conditions if she takes it frequently, but it's actually never been studied. And incredibly, it was over the counter, and we don't know the answer to that question.
Interesting. Well, this concludes our interview. I wish to thank you, Dr. Kahlenborn. Where can people find more information or find citations for the claims that you've made?
We have a research group called the Polycarp Research Institute, polycarp.org, and people can look up the information, they can ask me questions, and most of the studies can be downloaded from there.
Thank you so much again.
Thank you.